temporal. Yeah, so beginning right about here, everything above that's all superficial temporal, including that little one. Remember, maxillary goes inside deep. Okay, that blue line is the superior sagittal sinus. Don't forget to put a vein after that. Right under the bolt here is the confluence of sinuses, and that leads into transverse sinus. And if I go way down deep there, the little curvy one, I don't know if you guys can see it, sigmoid sinus. And right around the foramen magnum, don't worry about that one. This one, though, is new. What's that one? Let me aim it this way at you guys.
Superior
Petrosal sinus. That's on top of the petrous portion. And in this blue one, I don't know if you guys can see what I'm pointing at. Look through the red arteries. That's the inferior petrosal sinus. So it's the little blue one way in there. Go through the arteries and you'll see a blue line. And that's it for this guy. So I'm going to put him down. What have I not done? These two? Okay, let's do these two, and then we need to do Circman. Diaphragm I did for you earlier, but I can do it again if you guys want. Oh, good. Nobody removed my tapes. I put some tapes on here yesterday. Okay, let's do this one first. This obviously is the hyoid bone. Thyroid cartilage is here. The one that looks like a ring is called either cricoid or cricoid cartilage. I'm going to flip this around. This is all broken, but anyway. This is the epiglottis here. What sits on top of the cricoid or cricoid cartilage, which I'm pointing at, are these two that move, and they move the vocal cords. Those are the arytenoid cartilages. And do you guys see a little pointed kind of, here I'll point, he's kind of flipped around, but that little tip is the corniculate cartilage. So think of a corn on your toe because it sits on the arytenoid cartilage. You don't see the cuneiforms, they would be in here. And the vocal cords are all collapsed in there. That's supposed to be those little tissue things in there. Students broke them already. Okay, this one's a much better model, and I told you guys the numbers in your gold book match this. So let's start here. What's that cartilage? Yeah, that's the thyroid cartilage. This blue one below it, cricoid or cricoid cartilage, and I'm going to flip it around to the back. Now that's much bigger. So that's still the cricoid cartilage. Again, it's like the fat part of your ring. Right on top of it is the A cartilage. It's pronounced arytenoid cartilage. And the other one's covered with muscle, but you can see it here. And these are so tiny. Do you guys see two little blue tips? I don't know if you can see two little, there's a flower, tiny tips. Anyway, these are tiny tips. That's, or maybe it's tiny tips. Anyway, these two little things are what cartilage? Like the corn on your toe? Those are the corniculate cartilages. Really super small. They have a 5 on them if you can look at these painted up fingers. You guys are taking pictures. Anyway, I put my tapes on that long name, which is a fold. Airy something fold. So the blue tapes are on the airy epiglottic fold. So those two tapes are on that fold. The epiglottis is up here covered by mucous membrane. What if I said name the cartilage inside there that you cannot see? Cuneiform cartilage. So I would have to word this one of two ways. Name the fold or name the cartilage inside the fold. And again, the cartilage in there that you cannot see is the cuneiform. And if I were to pull this guy up, he doesn't want to pull up. And open him up, and then I'll do the Circman for you. And you guys look inside. What's that white thing there? Vocal cord. Don't want you to miss the obvious. And anybody know the name of that fold above it? It's called the ventricular fold. Yeah, you can say false vocal cord if you want, or ventricular fold. Now real fast, you want to do the Circman? Why don't we do the white one first? Do you guys have a white one handy? Did I do the other models?
Yeah.
Anybody have a white one? Thank you. You know what, I'm going to ship it here, guys, so you can have to get closer. Thank you so much. So yeah, get as close as you can. This is the most basic. One more.
Oh, she's going to be there.
It's like he's famous.
Yeah.
That's you too.
Guys, do you see my gold book? Is that right there? Oh, yay. Awesome. Thank you. Yay. Because I have little notes to myself. Like what Jocelyn said, sequential whatever. Anyway, are you here, Jocelyn, or she's probably gone? Okay, let's look at this. Guys, I'm going to... Don't worry about his head, because I will use this one instead. That right? Okay, start at the aorta. The aorta forms the arch. And then that little first one off there is called the brachiocephalic artery. Yeah, if you can't see, just come in close. That's the right common carotid, right subclavian. That keeps going and forms the axillary somewhere in the armpit. I could go on this. Do you guys see where the humerus connects in there? Yeah, it's probably better on this side. So let's do that again. Subclavian, like right where the humerus connects. Axillary. If I'm full on in the arm, what is that? Brachial. Oh, I didn't do these three guys up here. Vertebral is the most medial one. You guys see this one kind of goes to his thyroid. That's the thyrocervical, and this one goes to the back of his head. Costocervical. Those are those three branches. Okay, let's say we know the brachial artery is this one also. This one above his thumb is the radial artery. This one on the other side is the ulnar artery, turning into the superficial palmar arch right there. And those little arteries on the fingers are digitals, or digital arteries. Okay, this is probably the hardest part here. Do you guys see this little artery with the paint scraped off? That, go ahead and call that the celiac trunk. So it's got paint scraped off, and that divides into the artery to the liver called the common hepatic, I had to think, common hepatic artery. This little thing is supposed to be the stomach. And so that artery going up is the left gastric. And then if you come over this way, that's the splenic artery. So again, common hepatic, left gastric, splenic, and those are all coming off of the celiac trunk. Okay, this little hole is the superior mesenteric. The red ones are the renal arteries. This one is the inferior mesenteric. These two are common iliac arteries, with the internal iliac artery going in and external iliac, you know, it keeps going. And let's say that's his inguinal ligament. What would be down here? Femoral. I'll go on this side because it's easier. Femoral arteries here. What's at the back of his knee? Popliteal. What's this artery going forward?
Anterior tibial.
Anterior tibial, back there. Posterior tibial. Anterior tibial at the top of the foot turns into what? Dorsalis pedis, and then I'm going to skip over here. Do you guys see a little, whoop, it's going to fall down. This little arch, that's the arcuate arch. And digital arteries go to the toes. Veins, greater saphenous vein here. I didn't ask that many veins on him. I don't think I put these in, but that's external iliac, internal iliac, common iliac. What's this vein? Inferior vena cava. You guys know that's the superior vena cava. Did I identify that? That's the pulmonary trunk, which is an artery. The brachiocephalic veins are not real good on this, but that's those guys. And finally, his superficial veins over here, cephalic is this long outside one, basilic is the inside one, and this is not where it should be, but let's use it anyway. That's the median cubital. It's supposed to be kind of across his elbow, so that's the median cubital. Then I think that's it on him. And then on the green one, if you guys want to come back here, or you can just pass it to me. Somebody want to pass it, and then I'll show you.
My arms are so wobbly.
I
know.
Yeah, let's go through everything on him. If you're in a super hurry, let me show you the two on him that the other guy does not have. And that is these long ones going down would be either his testicular or her ovarian arteries. But if we come back to the top, again, aorta. On him, you guys can just say aorta. But for lecture, no, ascending, arch, and descending. But for this guy, aorta is fine. Okay, brachiocephalic is up here. Divides into the right common carotid, right subclavian. You've got vertebral, thyrocervical, costocervical branches. As soon as it gives off those branches and gets into his armpit, it's axillary. Then brachial, and now I'll skip over to this side. Brachial turns into the radial, and the ulnar with the superficial palm.